Oklahoma is one of the latest states to consider expanding Medicaid. This is a process that's been in the works for a little while in the state. It started with a bill introduced earlier this year. It included Medicaid expansion, but it also had some strings attached to that Medicaid expansion with provisions like work requirements, like we've seen in states like Kentucky and Arkansas. Now, after the legislative session ended and we were into the summer months, a working group has been formed. This is a bipartisan legislative committee working on recommendations for the next legislative session on whether or not the state should move forward with a Medicaid expansion plan. Separately, there is a ballot measure going around. Signatures are being collected that could potentially, if enough signatures are gathered, put Medicaid expansion to a referendum to the people of Oklahoma in the 2020 election. Currently, about 20% of the state's population is enrolled in Sooner Care, their Medicaid program that exists right now in the state, the majority of which are children. It is considered to be one of the strictest Medicaid programs. It has very strict eligibility rules, keeping a lot of low-income people from the program, hence the need for a consideration of expanding that out to cover more people. And the statistics that make that possible are those that show that Oklahoma is the second highest uninsured rate in the country, following just behind Texas. So there is a lot of need in the state for people going without health care coverage. If you are actually going to look at a map of the state of Oklahoma, the highest rate of uninsured is actually in that panhandle section. There is a growing need for people to be connected to health care and coverage to get a little bit healthier in the state, which is why it's being formed now as a bipartisan effort to have these conversations. If Medicaid expansion were to pass, an additional 550,000 to 630,000 adults would be eligible. There are two different studies that separated by a couple of years, so these are projections of how many people could gain eligibility. But both studies acknowledge that having eligible people actually enroll might be a little bit higher hurdle. So only about half of the people eligible are expected to enroll. So we're still hoping that they would gain at least 300,000 new enrollees into that Medicaid expansion program if ultimately successful. It also is being supported by individuals that see Medicaid expansion as a way to help keep some of those rural hospitals in the state open. A lot of them have been closing lately due to a lack of funding, and this certainly would be a payer source for a lot of those lower income patients. Now, we said that there are a couple states remaining that have not yet expanded Medicaid. Oklahoma is one of 14 states that has not yet accepted Medicaid expansion. A report estimates that Oklahoma's share of the cost would range from about $137 to $158 million if this was actually implemented by the year 2021. But their overall net cost would actually be much lower when you start taking into account some of those anticipated savings in other programs. Now remember, if Medicaid expansion in its fullest sense is implemented in the state of Oklahoma, the state is only responsible for 10% of the cost. The feds would pick up the rest, the other 90% of the cost. So this could be seen as a big financial boom for the state of Oklahoma, freeing up state money that could then be used in other initiatives. Right now, Oklahoma is spending over $1 billion in their Medicaid program, and that's without expansion. You could read more about the proposal as it stands now with the working group getting started and a little bit more on that ballot measure that folks are hoping to get on the ballot in 2020 in the state of Oklahoma. If you like this video, go ahead and click the like button and subscribe to stay up to date with other hot topics in healthcare and coverage.